Hey everybody, it's Donna Cravata, and we are back with another installment of the Real 50 Over 50. And this week we have Rachel Braun Scherl with us, and I'm so excited to talk to her. We shared a little bit on the last panel that we had. She was on the panel for women's leadership, but today we get her one-on-one, and I'm so excited. She is a Vagipreneur, and we're going to talk more about that, a keynote speaker, author, femtech expert, advisor, and a board member. She's blazed a trail in a field labeled taboo and successfully started her own female health and wellness company and created a new category in the process. Today, Rachel works with both large and small companies that offer products and services for feminine sexual health, reproductive health, and women's wellness solutions from menstruation to menopause. So the gamut. Welcome, Rachel. I'm so excited to talk to you today.
Well, thank you so much. It's great to be here.
Let's dive in with the title of your book and what it means to become an orgasmic leader. I mean, that's something that I know is you're very passionate about, and I'm sure that there are questions about what that actually means.
So thank you so much. And the way it came about is, we were fundraising. We had 13 appointments in 2 days, and the first one, they're laughing or they're quiet or they're making sexual jokes. The second one, they're asking about Viagra, whatever the case may be. And the third one, we said, well, this isn't working. Let's go in with a new strategy. So my business partner and I huddle, and I have $100 bill, and I smack it on the table. And I said, here's a $100 bill. If you make a joke that we haven't heard before, if you make a double entendre that makes our face turn red, if you ask us a question about the category that we can't answer, this $100 is yours. And then I pause and I said, she likes it more. She wants to have it more. Let's talk about the business. And I look at that moment as the moment I became an orgasmic leader, in the sense that for me, it's when you're taking control of the conversation. So, you talked about it being taboo. One of the biggest challenges with taboo is silence, and lack of education, and fear and discomfort. So my approach, as I'm sure you can see, is incredibly direct. It's unapologetic. I can talk about, vaginas all day, every day, the way other people talk about cybersecurity. And to me, it's just so important, not only that we have the dialogue, but that we have the vocabulary and the settings to have those conversations. So to me, being an orgasmic leadership means unabashedly being part of the conversation.
It's so important. Early on in my business, I had a client that was a health coach, and she started focusing on female wellness and health, and I was trying to get some PR opportunities for her to write for different publications, and I ended up getting into a fight with a publisher about the use of the word vulva. And I was like, well, you know what? My client's not writing for you now. Because they wanted
we've
us
made
to
a lot of
phrase it right.
progress. Yeah, we've
Yeah.
made a lot of progress. I mean, the reason I started speaking in this space was really in response to a business challenge when I was, when I co-founded a first company and we had a product that improved arousal, desire, and satisfaction for women. We found that we went to 100 media outlets across all channels, and no one would take our money. So we said, well, if we can't buy media, we're going to earn it. So it was part of that I started speaking frequently, on TV, to reporters, to online journals, whatever it was, to have the conversation. And it was really instrumental in helping us build the business. And if you look at companies that have been created over the last several years, so many of them have what I call their fighting City Hall moment, where you're fighting sort of the blocks and the barriers as opposed to, the business of building the business. But it's very common in this space. We create warriors. You come into this space for many, many different reasons. Maybe it's solving a personal health problem. Maybe it's because you see it as a huge financial opportunity. But at some point, everybody winds up becoming a spokesperson for the validity of the space.
Yeah, the validity of the vulva.
Yeah. And, it's not surprising that you can't say the word vulva. We have an amazingly poor system of sex education, certainly in the US. over 30 states require sex ed. A subset of those don't require them to be medically or scientifically accurate. So
Yeah.
yes, we require it, but you can share nonsense, nursery rhymes if you want. We teach abstinence in more states than we teach consent. And I don't think there's ever been a parent or a child who looks forward to having the conversations about the birds and the bees. That doesn't make it any less important. And so
It's so,
we come into this conversation as adults without really having the skills to figure out what the words are and how we want to talk about it.
yeah. And I have a son, and I think that it's even more so lacking for young boys than it is for girls.
Well, and I also think in this
And it's hard.
environment where, sort of fear is the leader of the conversation, knowledge really is power. I have a son and a daughter, and I had different conversations with them when they were heading to college about the things that they should think about and be concerned about. But, you know, everybody should know about respect. Everybody should know about consent. Everybody should know about, consenting adults and, what no means. That's not just me working in sexual health. That's critical for relationships. And one of the pieces of information that has always shocked me, and so I share it, is that there's a growing body of research that children who are taught the right names for their body parts and how they might fit together, and the names of their genitals, as opposed to giving them funny pet nicknames, they're more likely to report instances of abuse or trauma. Because how do you describe something that happened to you if you don't know where it happened? So I think for so many reasons, that's relatively extreme and not positive, but important. It's really important to have these conversations, and it's really important for kids to have these vocabularies, and for teenagers, and for everybody at every stage of life. And we see it now. You're focused on 50 over 50 in the menopause conversation. It's taken us a while. But when enough people are talking and putting enough money towards it, and Oprah says it's fair game, it's created a conversation that's critically important. The single biggest thing we hear from women in menopause when we're presenting them with different options is, I thought I was alone.
Mm.
And you hear that with people who went through fertility. You hear that with people who go through PCOS. And the beauty of what's happening now is there are communities. There are people to support you who have shared a similar experience.
Yeah, and this project has really highlighted that so much for me, because I hear that over and over in these interviews that, everything changed when they realized that it wasn't just them.
Yeah, it really is transforming. I don't think anyone ever felt better feeling that they were the only one who, was suffering. I
No.
think there is. I don't think you're not wishing suffering on anybody else, but knowing that someone else understands what you're going through, and has empathy. And when you think of, just for menopause specifically, the dozens and dozens of symptoms, many of which people don't associate at all with menopause. We're hearing this now in the workplace, that now companies are providing coverage for menopausal services. We hear 6,000 women a day are going into menopause in the US, 20% of the workforce. This is not insignificant. This is a huge productive workforce. And I think what we're seeing now, again, for the 50 over 50, is the women in that age group, in that stage, are some of the most experienced people at a company, and we need to find ways to keep them. Same as 25 years ago, we said, wow, we have professionals of childbearing age or family building age, and we need to provide benefits that enable them to stay.
Now, are you seeing an increase in that?
Yeah, 100%.
Okay,
I'm
that's
seeing an increase in the conversation. I'm seeing an increase in the number of companies that are providing menopause care. I'm seeing an increase in the data that's created. So Mayo Clinic did a big study talking about, the cost being at a minimum $1.8 billion for, the cost of menopause. And there's a bunch of different ways to look at it, whether it's the healthcare costs or the lost work days or whatever it is. But once you put a number next to it, it actually makes the conversation easier.
Yeah.
So I always laugh. My litmus test for someone who's been in menopause or in the space, I don't mean experiencing menopause, looking to finance or be involved in the space, if they say something that sounds like, oh yeah, I just looked at a menopause company, I got it. That reflects, a very limited, if any, understanding of the complexity of women's health. And that's one of the reasons this whole conversation around hormonal health has become so important, because hormonal health matters at any stage in your life.
Yeah.
It matters when you're going through puberty. It matters when you're menstruating. It matters when you're actively trying to get pregnant. It matters for fertility. It matters for menopause.
It really does. And it changes like constantly.
Right.
Constantly. And, you know, as women, we're going through this for most of our lives in one stage or another. So we're always battling something. So
And I
one of
think what people are always surprised to learn is you wind up spending, for the most part, on average, spending way less time in the period of trying to get pregnant than either not trying to get pregnant or being past that point where you could get pregnant.
Yeah.
So, the window that we focus on, incredibly important. And we
Mhm.
have lots of solutions that are being created and scientific advancements. That's one piece. And so when you said at the beginning, I focus on menstruation through menopause, I look at the range of
Mhm.
her sexual and reproductive health. And reproductive health isn't just when you're trying to reproduce.
Yeah. Yeah. And, hopefully we can, not get thrown back into the Stone Ages with this.
I think there's enough people, there's enough strength in numbers, and there's enough progress that I'm not worried about that. We have a long way to go, but the only way to stay optimistic with this big challenge is to focus on the wins.
Yeah.
So that's really what, I try to do, and so many people in the space that I think of. It's very easy to fall back on the statistics that are very concerning. But then you can say, well, the White House just announced their first White House initiative for women's health.
Mhm.
That's huge.
That
That's cataclysmic in the most positive way in women's health.
Yeah. All right. So let's talk about turning fem health problems into opportunities. And I know that this has been a big part of your journey through all of this work that you've been doing for many years. And so it's got to come from ideas. It's got to come from a need. It's got to come from something that doesn't already exist. How does that happen?
Yeah.
Share some stories.
So, and just to be clear, I really focus on working with companies
Mhm.
that have products or solutions and helping them grow in the women's sexual and reproductive health stage. So there are lots of problems, challenges, life stages, experiences that women go through that no one had ever addressed. What's interesting about women's health is many times you're competing against inaction,
Mhm.
as opposed to, think of a very simplistic example. If you're thinking about changing your shampoo, you're already washing your hair.
Yeah.
So you're just picking something else to fill that need. Often because people have so little understanding of what the cause of the problems are and what the options are, they don't think about, are there supplements? Is
Mhm.
there telehealth care that I can access that will help me when I'm experiencing this, that will save me time from going into the doctor's office or to the ER? So, for instance, I'm working with a company right now, this brilliant cardiologist, Dr. Suzanne Steinbaum, who's been treating women and women's heart issues as well as men for decades. And she's recently created a SaaS platform to systematize
Mhm.
the timely and accurate diagnosis of heart risk. And we've heard much more over the past, certainly the past year, that women's heart attack symptoms are very, very different. So you take that, that's a critical issue. You want to diagnose that soon. When you put things through her SaaS platform, you get a much more accurate risk assessment. And for every woman who goes into the ER thinking she has symptoms of a heart attack and doesn't, that's an $18,000 expense. So it's good for her, it's good for the system, it's good for the employer, it's good for the family if we have better understanding of what the symptoms are, how concerning they should be, and when you seek medical care. Another great example is the number of businesses, device companies that have been created so a woman at home can monitor her maternal and fetal heart rate.
Mm-hmm.
So every time you have a concern, you don't necessarily have to figure out the rest of the logistics of your life with other kids or work or whatever it is to get medical care, but you now have a conduit with important, timely personal health information where a doctor or a healthcare practitioner can figure out
Yeah.
in real time what it is that you need.
Yeah.
I think telehealth is a particularly good example. Being starved for time and not being able to fit anything in is not a uniquely female problem.
Mm-hmm.
But when I think about what telehealth has done for the treatment of menopause, number one, now there's a place to go, there's a place to call, there's information to get, there's things you can do to improve your experience. You can miss less work, you can feel less alone, you could resolve some of the symptoms.
And not
So,
sit in fear.
it fits into when you talk about these trends, COVID catalyzed a lot of this stuff.
Yeah.
Where we couldn't do business as usual and we had to figure out ways to get important questions answered. And women's health, menopause specifically, has really lent itself and benefited from the growth of telehealth.
Yeah. I have AFib, and it's helped me quite a lot to be able to have, I have this little device that I
You have your monitor at home, so you know when you're supposed to
call
panic,
the
right?
cardiomobile. I have an internal heart monitor, and my doctors have gotten me back into rhythm with meds over the phone.
Which is mind-boggling.
Yeah, I mean, I can PDF my reports right to my doctor's office.
So think of the lessened emotional burden, financial burden, time burden, anxiety burden to the healthcare system that is created every time we add extra interactions. I think that's a perfect example. And for women's health, data is so critical. So much of the data that we're collecting on these devices and these apps did not exist.
It did not exist.
And in the gap left by that, companies are stepping up and saying, well, we're going to help educate you about the symptoms of menopause. We're going to help you figure out if you're starting to see symptoms of something that could be concerning in whatever condition or whatever set of symptoms you're experiencing. And unfortunately, with all this data comes the risk of privacy. I don't think we've sufficiently figured that out, but the data being turned into information for predictive analysis and using AI to diagnose more accurately and early. All anyone wants is a healthier population and better outcomes. And I haven't heard a physician or a healthcare practitioner say that something doesn't benefit from better, more accurate early detection.
Yeah. Yeah. Just from my experience alone with this whole AFib journey, I'm always looking for new solutions and for what's happening now, and finding the doctors that are open to trying something new, not just doing what has been available to them for 40 years. And it really is a broad range. I mean, you
But
really
I
need
think
to.
the fact that you're talking about your AFib is symptomatic in a positive way of what's changed. So if
Yeah.
you think, before COVID, think of the transformation and the conversations around mental health.
Hmm.
We're in that center of the storm right now for women's health, even being comfortable. Not that there's anything you ever should have been ashamed about being an AFib, but by virtue of putting it out there, you're creating an opportunity for someone or a number of people to start to delve in and maybe reach out to you or ask questions if they think they're having similar symptoms. So it's the quantitative data,
Hmm.
and it's also the qualitative conversations that are critically important.
Yeah. I went and had training to become a patient advocate because when I was diagnosed,
Amazing.
which was just before COVID hit, I was diagnosed, and there was no information. It was really very limited. And you had to dig to find it. And most of the information was geared towards men, not women.
Mm-hmm.
And, I found resources and I found solutions. But like my first go around, I had no idea what I was dealing with, and I was not getting good answers, and I had to go in for an ablation quickly, and it was the wrong doctor,
Mhm.
and it was unsuccessful, and I actually ended up in worse shape than I was when I
Oh,
started. But, from that, I had to learn, and it was not easy, and
so
if I
when you
could
have
help
that caption on the bottom, turning fem health problems into opportunities, AFib again is not a uniquely female health
No.
experience, but your experience was different because of the medical community's knowledge and awareness, and your knowledge and awareness
Yeah.
about what the symptoms were. One of the really, I think, sort of groundbreaking things that's happened over the past several years is how we talk about women's health. So, historically, people referred to it as bikini medicine. It was either in your bra or your underwear. And
Oh,
those were the areas that we cared about in female health. Now, the much more common narrative is we look at women's health in three buckets: things that happen to women only, meaning you have to have the biologically female organs to experience issues, positive or negative, with ovaries. Same with the uterus. So things that only happen to people who were born biologically female. The second is things that happen to men and women, to women primarily.
mhm,
So everybody suffers from Alzheimer's. Women suffer in much greater degree. Everybody suffers from migraines. Women suffer to a much greater degree. Autoimmune diseases, women over-indexed. Anxiety, women over-indexed. So that there's that whole category that it's not uniquely female, but we're seeing females suffer in much greater numbers. And then the last one is, cardiac care is a good one, is things that women experience differently.
yeah,
So cardiac health is one of the best examples. The symptoms that women experience are quite different than the ones that men experience. I think we saw that during COVID when we had some data early on that women were faring better than men in terms of recovering from and surviving COVID. So if we think about it in those three groups, our conversation is much bigger
mhm,
than breasts and vulvas and vaginas and menstruation and pregnancy, because it really does affect not only the medical condition, but sort of the system response
yeah,
to that condition. And so your example with AFib is a perfect example. I would call that women's health,
yeah.
even though AFib is not a uniquely female health challenge.
It's often misdiagnosed as
As
just
many,
stress
many, many things in
or
women's health are.
hormones or, any of those things, and, when the first, ablation that I went for, the doctor said to me, "Well, book it on a Friday, you'll Netflix for the weekend, and you'll be fine on Monday." I wasn't fine on Monday. I was an absolute mess on Monday.
And it might have been easier to know that he was on call if you did it on a Wednesday and you could call the office on Thursday. Now with telehealth, we obviously have much more access, but there's certainly some practices that still run on a Monday to Friday. And, people
Yeah,
don't always get sick during the work week or,
nope.
or during the, physician hours.
No, it's really been an eye-opening experience because it was my first real medical situation. I was always the one taking care of other people and was in my full strength asking questions and advocating, but it was the first time that I'd really had to advocate for myself,
But
and
your response to doing that, becoming a patient advocate, is really the pattern we see all the time in women's health. A woman will experience a problem, a challenge, a situation. She'll, scan the universe and doesn't see a solution that would benefit her, starts doing research, realizes obviously she's not the only one experiencing this, and creates a company in response to that.
yeah.
I'm working with a company, Amy Buchalter at Pulse, when she was going through menopause and was seeing, what was not a very appealing state of lubricants and dealing with vaginal dryness. And so she hired a PhD and interviewed 300 women to
Mhm.
understand what their concerns are, what the pain points were, what solutions could be, what was missing. That's one of the things I so love about being in women's health is, people are explorers. They're trying to figure things out. Sometimes it's just an idea or an insight. Um, there is no dearth of challenges to solve in women's health. This could, take the rest of many, many, many lifetimes. And when people refer to women's health or even menopause specifically as a niche, I think of how many other conditions are there that affect 1 out of every 2 people on the planet,
Hmm.
and that could last for 7 to 10
Decades.
years. Some women are in perimenopause for 7 years, experiencing symptoms. Some, experience symptoms after that moment when they are in menopause, which is, the 12 months after not having a menstrual cycle. So, I mean, just think if people were looking at this, and some people are looking at it in its totality, how enormous this menopausal treatment market could be.
So let's talk a little bit about like fundraising for this. Like
Hmm.
how do you go into an organization and get people to pony up some cash for this?
A bunch of things. I mean, you have to kiss a lot of frogs. Ask
Yeah,
any
yeah,
woman raising money, any person raising money. We joke that sometimes you're in the eye of the storm. You're the triple threat. So you're a woman who's less likely to raise money. Um, you're in women's health, so you're less likely to raise money, and you're talking about vaginas or vulvas or nipple care,
yeah.
you name it, things that people are supposedly not talking about in polite conversation. So for me, it really has been about keeping a sense of humor and being unapologetic. And I don't go into any meeting thinking someone should invest because it's the right thing to do to care about women's health. I do think it's the right thing to do to care about women's health for many, many reasons,
Mhm,
not the least of which that women are often the primary caretakers and healthcare decision makers of the family. But if I'm going into an investor, my goal is to communicate how, with this product, this service, this company, this team, they're going to get a substantial, significant, meaningful return on their investment.
mhm,
So, I go in really very much, and I've seen many successful people fundraise do the same thing. I mean, it is a business opportunity. You have to tell a compelling story about the problem you're solving. Is it really a problem? Does it really need a solution? And how is your solution, I say,
mhm,
better, faster, cheaper? How is your solution different? And I
mhm,
often, when I'm speaking with students, which I do quite a bit, is I think of that they all know Warby Parker.
mhm.
But it wasn't as if before Warby Parker, no one could get glasses.
Yeah.
You and I got glasses before Warby Parker. We needed glasses before Warby Parker existed. What they did, in my mind, I wasn't part of the team, is they broke down the process and fixed every step. It
Yeah.
was too expensive. It took too long. It was hard to see what you liked. All those things. It was hard to get an appointment. They took a problem that was being solved and found an entirely different system to solve it.
Mhm,
And that's to me what's the really exciting piece. And in women's health, as I said before, you have many sort of untapped areas where we haven't even ventured into solutions. There are fewer of those now, but they exist. And so if you have a problem and you have a better solution, a better mousetrap that's meaningful, um, whether that means clinically proven or lifestyle enhancing or whatever your endpoint is, then show how that's a business that someone's
mhm.
going to make money from.
Yeah. And
This
and
is not philanthropy. When you go into a venture capital company or an institutional investor, they're not doing this for fun. Their
yeah.
objective is to make money for their investors. Full stop. And if you make it easy for them to see how that can happen, that's a successful pitch.
And have you seen, a change in willingness and openness to the topics that you talk about over time, or
A spectacular change
okay.
for a number of reasons. One, there are hundreds and hundreds of companies being created every day, and there are thousands of companies that are in some aspect of women's health. There are more creative sources of capital, whether they're angel networks or venture capital funds focused on diverse founders, which includes women. There are funds that are specifically focused on women's health. There are funds that are specifically focused on female leaders. So a lot has changed in that area. And we have, again, I think COVID was in its own way, as many horrible things as there were, related to that. it enabled us to have conversations that we weren't having before. Like, you could see how the infrastructure of the family was falling apart when schools were closed and moms couldn't work. And I'm not saying men and same sex. I'm not saying that there weren't other people who had that challenge. I'm saying if you look at what happened in what they historically used to call traditional households, which are not traditional anymore, the bulk of the work and the bulk of sort of putting something in the dam so it didn't break was really on the women.
Mm-hmm.
And so I think because of that, we are also now having more conversations. Again, more companies, more people. We now have this White House initiative. We're having these conversations in the workplace about menopause that literally did not exist several years ago. And I always say this, anything that Oprah does is good for business. Oprah being public about experiencing menopause, and many other celebrities and people with public platforms, that helps. All of that helps, and it makes a difference.
Yeah.
Is it still hard? Yes. Is it as hard? On the margin, it's definitely not. Even though the statistics don't show that much of an improvement in terms of, for instance, a percentage of venture capital that goes to women, there are fundamental shifts
Mm-hmm.
in the ecosystem. And there is an ecosystem.
That's good. That's really good, because we're not going anywhere. That's another thing that came loud and clear through this project, is we're here.
Yeah,
And
it's
we're
amazing.
not
And
done.
one of the most important things that's happening across categories, I mean, even you take, dating apps where you put the power in the woman's hand. That
Mhm.
was a breakthrough approach to say she gets to swipe first.
Mhm.
That's a really cool idea, and obviously was appealing enough for millions of people to jump on that.
Yeah. Well, here's to more change.
Absolutely.
So we are at 30 minutes already. And one of the things I like to do to wrap these up is to just ask our guests to leave everyone with a wisdom bomb, something that is either actionable or something that you want to leave people with, just so they know.
So this is always easy for me. Thanks to my dad. One of our movies that we watched growing up was this futuristic, violent film called Rollerball, where men played with spikes on their hands and on motorcycles, with spikes on their motorcycles and spikes on their boots, and you had to get this huge metal ball into like a target, like what you do at the beach. I can't remember the name of that game.
Volleyball.
No, where you roll the ball and it goes into a hole in the middle. Anyway, so you had to get this ball into a target. And before every match, the referee would sort of lay out the rules, and he would say, no timeout, no substitution. You play to the death, which granted sounds morbid and doesn't sound like a family activity. But the way my dad translated that for us is no timeout, no substitution is how he taught us to live. How you work, how you love, how you build relationships, how you contribute to your community, how you focus on your family, that, there are people counting on you every day to show up and work as hard as you can on whatever it is you're focused on every day until you're out of time, or, out of patience, or out of energy. And then you go back the very next day and do it again. So I've always found that a very useful way to think about building a business, but also building a life.
Yeah. So every day is full out.
Which gets exhausting. So the next time we talk, we'll talk about the whole growth of wellness and how, there's a greater awareness of, women and everybody needing to take care of themselves physically and emotionally. But yeah, the concept is you give it your all.
Yeah. That's how I go too. Probably why I have AFib.
And it's interesting. Brene Brown has this amazing expression, which I love, which I'm paraphrasing, but she says, if you don't feel uncomfortable every day, you're not trying hard enough.
Yeah. I love that woman. And it's true. You have to, I mean, if we would have stayed in the zones that kept us comfortable, we would not be doing what we're doing today.
For sure.
For sure. Because this is certainly not comfortable every day. Okay, so please connect with Rachel. Her website is below. She's also on the Real 50 Over 50 webpage. And I thank you for being here today and sharing all of your stories and your wisdom and all of the things that you've done to further women's health and women's well-being in the world in
Well,
every
thank you so
aspect.
much for creating the platform that you did and for giving us space to have this conversation. Not just this one we're having today, but all the ones that you do are focused on important issues that we need to be having conversations about. So thank you.
Yeah, I absolutely love doing it, and I look forward to sharing many, many, many more stories. So please come back every Wednesday at noon Eastern time. And if you're listening on the replay, please tag us, and we'll come back and keep the conversation going. And everybody have a lovely Wednesday.